Hey guys, Dr. Roberts here with Ultimate Bariatrics, doing our live video segment. This week I wanted to talk about postoperative care, mainly why it's important for our post-op patients to follow up with their primary care doctors. The main reasoning for this is that a lot of things change after weight loss surgery. Not only is weight loss going to be pretty dramatic and rapid, but also your medical problems could also change pretty rapidly and pretty dramatically as well. Patients that take blood pressure medicine, patients that take medicine for diabetes might notice some substantial changes in their medicinal requirements and really what's going on with them after surgery. A lot of times after bariatric surgery, we have to stop certain blood pressure medicine and certain diabetes medicines, and this can drastically affect your postoperative outcome. So it's very important that we, encourage you guys to follow up with your primary care doctors very soon after surgery. Of course, we try to keep our primary care physicians involved as much as possible, but nothing's better than having you guys reach out to your primary care docs and get into the office to see them. I encourage my patients to take blood pressure medicine, to record their blood pressures and record whether or not they're taking their blood pressure pills. I usually stop blood pressure medicines that are combination pills that have diuretics, as this can precipitate dehydration and cause unneeded ER visits for dehydration after surgery. Sometimes patients' blood pressure is normal after surgery even without their blood pressure pills, and taking those blood pressure pills can make their blood pressure too low. I've definitely seen patients in the office that didn't feel well, they were feeling weak and lightheaded. When we checked their blood pressure, it was severely low, which is not only scary but dangerous as well. And it's easily absolved by just not taking the blood pressure pills if they're not needed. So I highly recommend patients to check your blood pressure after surgery, check it twice a day. If the blood pressure is high, take your medicine. If the blood pressure is low, then don't take your medicine. If it's normal, don't take your medicine. And if you're consistently not needing to take your medicine, that's a good reason to follow up with your primary care doctor. It's great if you can have that, notebook or piece of paper that shows what your blood pressures have been and what you've been taking or not been taking. That way your primary care doctor can make a really good decision about what changes you might need. Do you need to be completely taken off of your medicine? Do you need a different medication? Do you need a medication that doesn't have a diuretic in it? All these things are complicated and really needs your primary care physician's involvement. The same could be said for diabetes. This is another one that we commonly see. Patients not feeling well, feeling lightheaded and flushed, and a lot of times what happens is their blood pressure and their blood pressure might be normal, but their blood sugar is actually low. They're still taking long-acting insulin or taking some of their other diabetes medicines that can drop their blood sugars. And so I would encourage you to check your sugars, check them at least twice a day, if not more. A lot of times I stop any long-acting insulin as well as some of the oral medications that can possibly drop the blood sugar down into low levels. This is dangerous. So it's really important that you check your sugars and follow up with your primary care doctor. Once again, it's really great if you can record your blood sugars, what they've been, because your primary care doctor is going to want to see it. Your diet is going to be changing pretty significantly after the surgery, and a lot of times you can get a preview of what things are going to be like during the preoperative diet phase. So you should maybe have a little bit of an idea about what your sugars are going to be doing after surgery. Sometimes after surgery the sugars go up a little bit just from the stress of surgery, which tends to normalize over a couple of days. But the important thing is check your sugars. If your sugars are high, then I would take your diabetes medicine, record everything that's going on, and then follow up soon after your weight loss surgery with your primary care doctor so they can make an educated decision about what we need to do in regards to managing your blood pressure as well as your diabetes medicines. Well, I hope that helps. That's all I've got for you today. Again, leave some notes in the comments for us, questions, so that we can get back with you and use this forum to help you guys in any way that we can. We appreciate all of your attention and watching these videos. We'll see you next time.